All right. Thank you, everyone, for joining us tonight. My name is Stephanie Garner, and I am the Director of Parent Support and Education for Down Syndrome Indiana. And I'm really excited to be joined by my colleagues from the Alzheimer's Association. Our co-presenter tonight is Damaris Eisengruber and Damaris. Oh my goodness, I said your name wrong. I apologize, my friend. Damaris
You're
Eisengruber.
okay.
Damaris is a community engagement manager with the Alzheimer's Association. And we are going to be talking with you tonight about understanding Down syndrome and dementia. And we will have plenty of time at the end for questions if we want to have some discussion. We will be stopping the recording at the end of the presentation so we can have some discussion off recording if you're more comfortable with that. But we're really excited to share this information with you. And Damaris, I'm going to go ahead and hand it over to you.
Perfect. Well, thank you, Stephanie. As Stephanie mentioned, my name is Damaris Eisengruber, and I'm with the Alzheimer's Association. I serve as a DEI community engagement manager. So I'm very happy to be here with you all tonight. All right. So these are our 2026 Alzheimer's disease facts and figures. And I know there's a lot happening in this graphic, but is there anything that stands out when you look at this? Anything that you look at and you think it's pretty shocking? Like, for example, I can tell you that when I saw this graphic the first time, the one thing that out of everything in this graphic, the one thing that really stood out to me was, the fact that it kills more than breast cancer and prostate cancer combined. Um, there's over 7 million Americans living with Alzheimer's, and currently almost 13 million Americans are providing unpaid care for people living with Alzheimer's or another dementia. So about the Alzheimer's Association leads the way to end Alzheimer's and all other dementias by accelerating global research, driving risk reduction and early detection, and maximizing quality care and support. Our vision is a world without Alzheimer's and all other dementias. And I know the numbers you just saw right now were very overwhelming, but behind every statistic is a real person, a real family, a real story. And like I said, over 7 million Americans right now are living with Alzheimer's. That's 7 million lives changed forever.
Well, thank you.
So my hope today is that you leave not just informed, but inspired to share what you've learned, inspired to support someone who's struggling, inspired to stand with us in the fight for a world without Alzheimer's and all other dementias. All right, so before we go any further, let's take a moment to make sure that we understand the difference between dementia and Alzheimer's. So the terms are used often interchangeably, but they're not the same thing. And trust me when I say this, I thought I knew what Alzheimer's and dementia was. First of all, I thought they were the same thing, which it's definitely not. Dementia is the umbrella term. And then dementia is not just a single disease, it's an umbrella term like a heart disease that covers a wide range of conditions that affect memory, thinking, language, problem solving, and even personality. So these changes are serious enough to interfere with daily life and independence. They don't just affect the person living with dementia, they ripple out to families, relationships, and entire communities. However, Alzheimer's is the most common cause of dementia, accounting for 60 to 80% of cases, but it's not the only one. As you can see in this list, there's vascular, Lewy body, frontotemporal, other including Huntington's, and you can even have a mixed dementia, so you can have more than one at a time. So, like I mentioned, Alzheimer's is the most common cause of dementia, and age is the greatest known risk factor for Alzheimer's, but it's important to understand that Alzheimer's is not a normal part of aging. So, as you can see from this slide, Alzheimer's is a progressive disease where symptoms gradually worsen over a number of years. In the early stages, memory loss is mild, but as the disease progresses, individuals will need around the clock care. So populations at higher risk. So Black Americans are about twice as likely as white Americans to have Alzheimer's or another dementia. Hispanic Americans are 1.5 times as likely to have the disease as white Americans. Almost two-thirds of Americans living with Alzheimer's are women. Members of our underserved diverse communities are more likely to endure poverty and have more limited access to quality health care. They're also less likely to pursue a diagnosis, receive support, or participate in clinical trials. We've also noticed that Alzheimer's has a disproportionate impact on women. So in the United States, more than 11 million women are either living with Alzheimer's or caring for someone who has it. Another two-thirds of Americans living with Alzheimer's are women. Women in their 60s are more than twice as likely to develop Alzheimer's disease over the rest of their lives as they are to develop breast cancer. Again, these are all very shocking statistics. And I'll pass it on to Stephanie.
Yes, we also know that our loved ones with Down syndrome are at higher risk for developing Alzheimer's. And studies show that by the age of 40, most individuals with Down syndrome have beta amyloid plaques and tau tangles, which are the hallmarks of Alzheimer's brain changes. But yet, we also find that not all of these individuals go on to develop Alzheimer's symptoms. And so you might wonder, why do people with Down syndrome develop Alzheimer's at higher rates? And the reason is that beta amyloid plaque that builds up in the brain, the precursor to that protein is called amyloid precursor protein, or APP, and it's actually produced by the 21st chromosome. And we know that people with Down syndrome have an extra copy of that 21st chromosome, so they're producing more of that amyloid precursor protein. Studies show that about 30% of those with Down syndrome in their 50s and roughly 50% of those with Down syndrome in their 60s will develop Alzheimer's dementia, according to the National Down Syndrome Society.
So let's talk about the 10 warning signs of Alzheimer's. And I know when you look at this list, you are going to think, okay, I've done a couple of those things, because that is exactly what I thought. But it's good to keep in mind that these are all 10 warning signs are something that has to affect your daily life. So if it's affecting and progressing your daily life, then it's when you should seek medical care. But so the 10 warning signs are memory loss that disrupts daily life, challenges in planning or solving problems, difficulty completing familiar tasks, confusion with time or place, trouble understanding visual images and spatial relationships, new problems with words and speaking or writing, misplacing things and losing the ability to retrace steps, decreased or poor judgment, withdrawal from work or social activities, and changes in mood and personality. And again, like I said, it has to affect your daily life.
So, in people with Down syndrome, changes in overall function, personality, and behavior may be more common early signs of Alzheimer's than memory loss or forgetfulness. So, some of these early warning signs in folks with Down syndrome include reduced interest in being sociable, conversing, or expressing thoughts, decreased enthusiasm for usual activities, a decline in ability to pay attention, sadness, fearfulness, or anxiety, irritability, uncooperativeness or aggression, restlessness or sleep disturbances, seizures that begin in adulthood, changes in coordination and walking, or increased noisiness or excitability.
Importance of early detection. So if you notice any of the warning signs of Alzheimer's, whether in yourself or someone you care about, don't wait to make an appointment with a doctor. An early diagnosis can make a big difference. Some treatments are only effective in the early stages of the disease. So the sooner someone is diagnosed, the more options they may have. But it's not just about medication. When Alzheimer's is caught early, there's also a chance to make a lifestyle change that may help protect your brain health. Things like managing blood pressure, quitting smoking, staying physically active, and keeping the mind and heart engaged through social and mental activities. Early detection isn't just medical, it's deeply personal. It's about giving people the best chances to live fully with a dignity and support.
So we know that early detection is so important, but in an individual with Down syndrome, that early detection and diagnosis can be really challenging due to a couple of factors. First, for most individuals with Down syndrome, it's really hard for them to be able to reliably self report any memory concerns. And that's why some of those early warning signs for folks with Down syndrome are so important for us as parents and caregivers to really be tuned into. And the other reason is that assessing cognitive changes and cognitive functioning in an individual with an intellectual or developmental disability can be really challenging for the professionals that we are relying on to make that diagnosis. So, what do we recommend then? How do we make sure that we are able to recognize those warning signs in our individual? Well, the first recommendation is that we establish a baseline of adult cognitive and functional ability by the time that your loved one is approximately age 35. And then we want to monitor for changes in day-to-day functioning over time. And then when concerns arise, we want to pursue an evaluation by a clinician with expertise in dementia and hopefully someone who also knows about Down syndrome. But it's really important that cognitive testing alone is not used as the sole benchmark for the diagnosis of Alzheimer's. And then we also want to make sure that we are ruling out alternative or contributing diagnoses through a comprehensive evaluation. So, what other diagnoses do we want to consider in our loved ones with Down syndrome? And this is called, in the medical world, they call it a differential diagnosis. So, what else could be going on that could be attributing or contributing to some of these symptoms? And if you think back to some of those early warning signs, right, like lack of um, social interaction, changes in behavior, changes in sleep, things like that. Those are the things I want you to keep in mind. So we first want to make sure that we rule out any vision or hearing loss that could be attributed. Um, Maybe our doctor is attributing to early signs of Alzheimer's in our loved one. Because if you think about, like, maybe your loved one, like your thing every night is you sit down together as a family and you watch Wheel of Fortune or Jeopardy, and at some point your loved one loses interest in doing that and they start just staying in their room. Could that be an early sign of Alzheimer's? Absolutely. But it could also be that they just can't see what's happening on the television. Maybe they can't hear what's happening. And so they don't feel engaged. And so they're just withdrawing because they can't see and hear what's happening. And the thing that we have to consider about some of these differential diagnoses is these are very treatable conditions, right? And so if there's something going on that we can easily treat, we want to make sure that we are addressing those conditions before we jump to, oh, it's Alzheimer's and there's nothing we can do about it. Hypothyroidism can cause some of those early warning signs that we might associate with Alzheimer's, dementia, obstructive sleep apnea, right? We know that some of the very first warning signs of sleep apnea are changes in mood or behavior. So, that is a sign, early warning sign, along with sleep disturbances in general. So, want to rule that out. We want to also rule out osteoarthritis. For our loved ones with Down syndrome, self-reporting pain is incredibly challenging. For some of our folks, downright impossible. But if you think about it, right, if you have a loved one who's got osteoarthritis in their knee or in their ankle. Walking may be incredibly painful for them. And you may notice that they start to withdraw from just regular activities of daily living because it hurts them, and they're not able to tell you that. They may have some anger and frustration because they're in pain and they don't know how to tell you that. So we want to make sure that if there are any signs that lead us to think that they may have knee pain or ankle pain or just joint pain in general, that we're ruling that out. Atlantoaxial instability is another issue that can affect our folks with Down syndrome. And atlantoaxial instability is when your first and second cervical vertebrae, the ligament that connects those, gets loose. And so you get some movement between those vertebrae, and your spinal column runs through that canal. So when those vertebrae are moving, you can get some narrowing and compression on your spinal cord. And that can cause numbness or tingling in your fingers. It can cause problems with coordination and walking. So if you have an adult with Down syndrome that all of a sudden is not wanting to engage in writing or fine motor activities, could that be an early warning sign of Alzheimer's? Absolutely. It could also be that they have numbness or tingling and they just can't grip the pencil right. So the whole second column: depression, vitamin deficiency, celiac, heart disease, medication side effects and interactions, metabolic diseases, all of these things can produce some symptoms that could be attributed to some of these early warning signs. And again, it's so incredibly important that we talk with our physician and make sure that we are ruling out every other cause of some of those symptoms.
All right, so treatments for Alzheimer's. There is currently no cure for Alzheimer's. There are treatments that can change disease progression and drug and non-drug options that may help treat symptoms. So it's important to talk to your doctor to learn more about the treatment options and learn more about it as well on our website at onals.org/treatments. So the U.S. Food and Drug Administration has approved several medications that fall into two key categories: drugs that temporarily ease symptoms like memory loss and confusion, and anti-amyloid drugs that target the disease by removing beta amyloid from the brain. Clinical trial participants who received anti-amyloid treatments experienced reduction in cognitive and functional decline, meaning these treatments slow disease progression. These new treatments are pivotal, though not a cure. Today, there is a worldwide effort underway to find better ways to treat the disease, delay its onset, and prevent it from developing. We also have a blood test. It's a simple blood draw that looks for signs in the blood that are linked to Alzheimer's disease in the brain. Think of it as a screening test, not a final diagnosis. This is a test. This test is unfortunately not covered by insurance and has to be paid out of pocket, but our Alzheimer's Impact Movement is helping bring awareness to pass the bill to get it covered by insurance. Very much like the mammograms in the 70s. The US Pointer Brain Health Recipe. So the US Pointer Brain Health Recipe has to do with physical exercise, health monitoring, nutrition, and cognitive exercise. It's kind of like what we discussed earlier about making sure that you are working and, keeping your cognitive skills, working those cognitive skills and staying active. One of the most common questions we get is about how people can improve their brain health or lower the risk of dementia. We have known that many health behaviors and conditions can affect the risk of cognitive decline and dementia. And we now have evidence that engaging in healthy behaviors can have a positive impact on brain health. So the US Pointer study showed that a program combining exercise, nutrition, cognitive engagement, and health monitoring can meaningfully protect brain health. This was a randomized controlled clinical trial that tested two lifestyle interventions in a large, diverse population of older adults at risk for cognitive decline and dementia. Participants were in either a self-guided or structured lifestyle program You can see here the brain health recipe that the structure group followed, which is, this with physical exercise, health monitoring, nutrition, cognitive exercise, and cognitive function improved for both groups. But the structure group that followed this recipe showed the greatest benefit, performing at a cognitive level comparable to adults nearly 2 years younger. So it's why it's so important to make sure you're staying healthy and staying active and learning new skills to keep those cognitive skills. Are 10 healthy habits for your brain. So overall, here are the 10 healthy habits that are good for your brain health. You can see that the actions in the brain health recipe from the US Pointer study are included in here. Do as many uh, do as many of them as you can for maximum benefit for your brain. So like challenging your mind, protect your head, be smoke free, control your blood pressure, get moving. And even if it's, I'm just going to go for a walk, or um, staying active somehow, just staying physically active, making sure you get your 8 hours of beauty sleep, maintaining a healthy weight, managing diabetes, and eating right, keeping a good, healthy diet.
And I just wanted, can I jump in really quickly, Damaris?
Yeah,
I'm
of
so
course.
sorry. I just wanted to add that it is incredibly important for us as parents, guardians, caregivers, loved ones of people with Down syndrome to really think about these 10 healthy habits, right? These are habits that are going to be great for us as well as our loved ones with Down syndrome. But the thing that we have to keep in mind is that these habits are challenging, I think, for many of us. I know there are, when I look at this, I think, wow, there are so many things I need to be doing better. Um, but I make my own choices, right? I'm the one who does the grocery shopping at my house. So the food that is available for me to eat here is food that I chose because I went and I bought it. I am the one who chooses whether or not I get to go take a walk every day before I go to bed or after dinner or in the mornings. I'm the one that decides if I'm going to join a gym and I'm going to go work out on a consistent basis. Um, I'm the one who decides if I want to sign up for a class at the library so that I can meet people and challenge my mind and keep that social engagement. I make all of those choices for myself. For our individuals with Down syndrome, very often they are not able to make these choices independently because they're not the ones that are going to the grocery store and buying food. So even if they wanted to eat healthier, if we don't buy them that healthy food, they can't do that. Some of our loved ones are not able to go take a walk around the block on their own. They need us to be able to join them because maybe they need some supervision. I know that doesn't apply to all of our loved ones with Down syndrome, but for some of them. Um, and all of these things for our loved ones with Down syndrome, it requires us to buy in, our family to buy in, and recognize that these changes are really important, not only to our health, but to our loved one with Down syndrome. So if there's anything that I can stress to you about this entire presentation, it is that you have to make the conscious choice as a family that these things are going to be important to us, and we are going to make these choices together for the betterment and the health of our loved one. Thanks,
Definitely. No,
Doris.
thank you, Stephanie, for sharing that. All right. So I want to make sure that you know about the ways the Alzheimer's Association can help you and your community. No matter where you are on your journey, you're not alone. We have the 24/7 helpline. It's always open day or night, weekends and holidays, whether you're living with dementia, caring for someone who is, or just looking for answers. Trained professionals are ready to provide confidential support, guidance, and information. I've heard of folks who have said they simply called because they needed to vent and they didn't know who to talk to. Um, I've heard of individuals who said they've called because they were going through the 10 warning signs and they thought, hey, I think I'm experiencing a couple of these, let me go ahead and call. So they did. So anytime you want to call, have any questions, the 24/7 helpline is available. The Alzheimer's Association website, alz.org, is a powerful tool as well. It connects individuals and families to local programs, services, and educational resources. Whether you're looking for support groups, care planning tools, or information about the disease, it's all there, easy access, and always free. We also offer education support programs, both in person and online. These programs cover everything from the basics of Alzheimer's to advanced caregiving strategies and professional training. They're designed to reach all communities and are delivered by trusted staff, volunteers, and partners. Many are also available on demand so you can learn at your own pace. For caregivers and those living with dementia, we provide compassionate community-based support. This includes support groups, both virtual and in person, and ALS Connected, our free online community where people can share experiences and find encouragement from others who truly understand. We also offer tools like ALS Navigator, an interactive guide that helps families create personalized action plans based on their unique needs. And through local partnerships, we provide early stage social engagement programs and to help people stay connected and active. At the Alzheimer's Association, we're more than a resource. It's a partner in your journey. We're a partner in your journey. We're here for you every step of the way. And I think I mentioned this on the last slide, but My ALS Journey is a free and accessible app. It's designed for newly diagnosed early stage individuals and their care partners. It's created for those who already use apps. It offers personalized guidance, education, planning tools, activities, local resources, all in one place by delivering the right information at the right time. The app helps users navigate their diagnosis, stay connected, and take action with confidence. So to help fuel our mission, we engage volunteers at every level of our organization and raise funds to support our efforts. Often our fundraising events are the entry point for individuals to volunteer with the association. So let's talk a little bit about each of our signature events. So we have the Walk to End Alzheimer's. It's held annually in more than 600 communities nationwide. The Alzheimer's Association's Walk to End Alzheimer's is the world's largest fundraiser for Alzheimer's care, support, and research. This event calls on participants of all ages and abilities to join the fight against the disease. And fun fact that I learned when I started with the Alzheimer's Association is that Indianapolis has the fourth largest walk in the nation. And yeah, so I thought that was pretty cool. We also have the Do What You Love to End Alz. It's a personalized fundraising initiative by the Alzheimer's Association that builds on the success of our previous event, The Longest Day. This is a refresh campaign that invites individuals to turn their passions into purpose by choosing any activity that they love, whether it's baking, biking, painting, gaming, or anything else, and using it to raise funds and awareness for Alzheimer's and other dementias. I think I heard of a couple individuals who have participated, and I remember hearing one time that someone they love bingo, or their mom loved bingo, and so they had a disco bingo night, and I thought that was just so cool. So before we wrap up, I do want to share a major opportunity for you to change the course of Alzheimer's in our community. Researchers have developed, like I mentioned earlier in our treatment slide, a blood test that can detect Alzheimer's before symptoms even appear. But there's a catch. A legal barrier currently prevents Medicare from covering them. As too many of you know, getting a diagnosis can take too long, and less than 10% of people ever do and miss a chance to get treatment. So we're calling this our mammogram moment. Just a routine screening transformed breast cancer outcomes. The Bipartisan ASAP Act will make early detection the standard for Alzheimer's. It doesn't mandate coverage, it simply clears the legal roadblocks so Medicare can provide it. Your voice is the only thing that can turn the scientific milestone into a reality for millions. So if you have a moment, if you could please scan this QR code to send a message to Congress, and you can take a moment to edit the email with your personal story, or it already has one drafted for you. But let's make early detection a standard for care. And so if you have a moment, I would really appreciate it. And I think this might be our last slide, but I can leave this up just so it gives everyone a little bit of time to scan. Um, but if you have any questions, please let us know. Thank you for again making time to join us tonight and for letting us talk to you about Alzheimer's and dementias and Down syndrome.
Damaris, we do have a couple questions in the chat, so I'll go ahead and read those because I think that they'll be really
Yes.
good ones for the recording. So the first
Okay.
question is: my loved one has four conditions with a higher incidence of Alzheimer's. So Down syndrome, Alzheimer's, bipolar disorder, and seizure disorder. Does a combination of risk factors raise the risk for having Alzheimer's or not?
Oh, that is a good question. I would say, fortunately, I'm not a doctor. We do have the 24/7 helpline that would probably give you a better answer. But Kevin, I know you're in the chat. If you do happen to have a little more knowledge on this, feel free to jump in.
Yeah, so hello all. I'm Kevin from the Alzheimer's Association, the Indiana chapter. Um, First things first, I would just to encourage to reach out to your providers. The helpline definitely helps. Now, when it comes to conditions such as that, such as so many of those conditions, I will say there are risk factors that contribute to a higher prevalence or a higher chance of getting or having Alzheimer's affect an individual. However, what we mentioned earlier are the risk factors that we are really promoting that we have control of changing, such as diet, exercise, sleep, socialization. So those are really the risk factors that we know that we can control or at least have an influence over. The other illnesses and conditions that you put in with this one, I am not sure of, but I do know there are some lifestyle behavior risk factors that can contribute to it. This is a great question that we're gonna take back and look at as well. But there are certain risk factors that can contribute to a greater likelihood um, of Alzheimer's happening.
So our next question is: are those with autism and IDD, so intellectual and developmental disabilities, similarly affected like those with Down syndrome?
Stephanie, would you be able to share more about or reemphasize the point you made at the very beginning about
Yeah,
why the
absolutely.
prevalence? And I think that would tie into this question.
Yeah, absolutely. So I do think that individuals with Down syndrome have a higher incidence of Alzheimer's compared with those with autism or intellectual disability because of that extra 21st chromosome, right? So folks with Down syndrome are going to experience Alzheimer's and dementia at higher rates than folks who only have autism or who only have intellectual disability. Now, I do think that in an individual with autism or IDD, I would say you're going to be looking at similar early warning signs, similar considerations when it comes to diagnosis and in that early detection, talking with doctors, ruling out some of those differential diagnoses, because very often our folks with autism and intellectual disabilities may struggle to communicate pain. They may struggle to communicate some of the other symptoms that they're feeling. So I would say in that regard, yes, that experience would be very similar. I hope that answers your question. If not, please let me know and we can talk more about it.
Thank you, Stephanie. Thank you, Kevin.
All right. And then we have one more question in the chat right now. Do we need to speak with a specialist or should we be starting with our family doctor if we have concerns?
Yeah, great question. So the place to start out is to talk to your family doctor. What will need to take place is a cognitive screen and working with someone who has Down syndrome, and to get that cognitive screen. And Stephanie, you might be able to chime in a little bit, this or a little more on this. Um, the standard way that I was thinking autism from the previous question. Sorry, the standard way that the Alzheimer's starts to get detected and diagnosis, it is a process. So it's not going to take place in one doctor's visit. So one thing that we highly encourage is when you do see your primary care physician or your family doctor, is to make sure you advocate and ask for a cognitive screening. So one very common one that is commonly used amongst professionals, it's called the Montreal Cognitive Assessment, or you might also hear it as called MoCA. And this is a common screening that really says, okay, so if these if a certain score hits this mark, that's more of a recommendation that your primary care physician would then start to refer you to a specialist. You can try to reach out to a specialist, but I will say that might be a little harder path, and it can take some time depending on how you approach it. But I would say the cognitive screen and actually the blood test that Maurice referred to earlier, the specific name of the blood test is called Lumipulse. And not every doctor, and we're still working with primary care physicians to educate them on all this process too, because there's a lot of positive momentum happening in the dementia Alzheimer's space right now that we're simultaneously working to educate primary care physicians as well. So the more you know, the more you can advocate and push for it. But the two big things is see a primary care physician to get a cognitive screening. The MoCA test is the one I referred to here, and if available, the blood test as well, because then those would have more definitive definitive markers to say to see a specialist. So starting with your primary care physician, and I would also refer just to the Alzheimer's helpline that Don Reese referred to earlier. That it's posted all over the alz.org website, so you can't miss it if you go there. But that would be a great way because that helpline is always answered by a master's level clinician who understands the disease and can help walk through not just the process, but maybe questions to ask the doctor as well.
I wanted to add just a couple of quick things. First, Kevin, there's a question in the chat. What does the MoCA test stand for? Would you be able to type that into the chat? And then also the name of the blood test. Could you type those two things in
Yes.
there so we could see those? Beautiful. Thank you, guys.
Yes, I will.
And then the one thing I wanted to add, oh, I'm sorry. I didn't mean to cut you off. Kevin, go ahead.
Oh, no, I said I can definitely do
Oh,
that.
perfect. So I think one of the benefits to starting with your family physician is that you can also start to investigate some of those differential diagnoses that we want to make sure we rule out. So if you're you can look at those early warning signs that have you concerned, and you can talk to your doctor and say, hey, I'm worried about Alzheimer's, but can we also think about what other things might be causing this and rule those things out in addition to doing the cognitive screen and the blood test, right? We can do all of this stuff simultaneously to make sure that we're getting our loved one the most help that we can. So we've got another question in the chat. Are cognitive screens effective with nonverbal individuals?
That is a great question. I am not sure how primary care physicians um, administer the test with non-verbal individuals. The test, or at least the Montreal Cognitive Assessment, the one that I put in the chat, that does have some questions that has pictures that has pictures on it. So I imagine some of it might be more physical. So point to this thing or write down this certain thing if that's an ability that can be done. But I'm not quite sure of that. So that's something we can look into. But I highly ask or suggest that you ask your doctor or call the helpline as well, because they might have more instances where they can direct you to how to approach that. Thank you for that question.
My guess is probably not super effective. We've got another question in the chat. Does DSI have contact information about doctors that specialize in adults with Down syndrome? We have had many people very familiar with Down syndrome that we've worked with at the pediatric level, but we've aged out. Oh, I tell you what, guys, adult physicians who are super knowledgeable about Down syndrome is an area that we need more knowledgeable physicians, and I know that's so frustrating. So DSI is collecting information always. If you have a really great physician that specializes, frankly, in anything, and they're knowledgeable about Down syndrome, if you want to call me, send me an email and say, hey, I love this physician. Here's the name, here's the group that they're with, here's their contact information. I keep all of that. We don't necessarily have it in like published documents because we don't personally recommend any physicians. But what I can share with you is if you reach out to me and say, hey, we need to find a doctor that we can talk to about Alzheimer's, I can then turn around and give you names of physicians that other families have shared with us. And so the answer is yes, we do have a couple of physicians. It's not a huge number, but we do have some physicians who have been recommended to us by families of individuals with Down syndrome. So, please, as you are navigating life, please feel free to reach out and give me names of really great adult providers, because we recognize that's an area that's really challenging for our families. Another question in the chat. Does Alzheimer's regularly display in those with Down syndrome in certain patterns, like increased anger, self-care decreases, etc., or is it highly variable? That's a really great question. I don't know an official answer. I'm going to go with my gut, and I'm going to say it's probably highly variable, very dependent on your loved one and activities that they regularly participate in, things that they enjoy, and how the disease presents itself. And so that's why I think that it's so incredibly important that you do that baseline of cognitive and adaptive function on a routine basis, right? Do that at 35 and then maybe check it again so that we can see those changes, because very often what happens is, when you are in the thick of it, you may not even notice some of those small day-to-day changes that happen. And so you might miss some of those early warning signs. Another question, you mentioned Medicare doesn't cover the blood test. Do any private insurances that you've heard of?
There might be some private insurances that cover it. Most of the instances have been just paid out of pocket from what we from the individuals that we've interacted with. I'm not sure of any like private insurances off the top of my head, but it never hurts to ask and check. I will say typically if the larger national coverage happens, it's probably more likely that the private insurances will start to take fold. So that's another reason just to continue to advocate for this, as we currently have individuals in Washington working with legislators to try to get this through. So I don't have a direct answer to who, but it never hurts to check with your insurance on that. Lumipulse is the name of that, by the way. I put that in the chat as well.
Kevin, do you happen to know how expensive that test is if paid out of pocket?
I have heard various price points. I don't know if there's exactly one cost, but I've heard anything from 300 up to $3,000 out of pocket. So I think it just depends. It's definitely a range, and it's not one particular amount, and it's not a consistent amount. I would keep hearing.
All right, we've got another question, or kind of just a statement, but a baseline. So talking about establishing that baseline of cognitive and functioning at by the age of 35. But a baseline that is assessed on neurotypical tests is how effective. Fair point, for charting changes as they happen. I think that one of the benefits of doing that baseline is that we can do it with our doctor. And I think there are plenty of cognitive function tests that are for individuals who are nonverbal, who have, developmental intellectual disability. And so, I think the benefit to doing it early is you're able to find that test. And then once you know, okay, this is a test that we're going to be able to use, then you can replicate. You can make sure you use that same test down the road. And I'm going to do some research on that, and I will see if I can find what cognitive function test is recommended for our loved ones with Down syndrome. And then once I can get that, if it's out there, I will share that with you guys.
And Stephanie, I'm gonna add on to the question that was asked earlier about the doctors. Let's see here. Oh, do we have any contact? There are specialists that do focus on Down syndrome and Alzheimer's, but they are not in the state of Indiana. And that's the hard part of that. We might, like as Stephanie said, have physicians that understand it better, but the specific specialists, the individuals who are doing the research and studying on it, are not in Indiana. So Stephanie, this might be something to look into. Those specific individuals that what kind of cognitive tests or assessments they might recommend, or they might have something within their research studies they found more effective. So I wonder if that might be a connection we can make and continue to do resource searching on.
And we have a parent who's Googled the cost of the Lumipulse blood test, and Google says it's between $500 and $1,200 out of pocket. That is a very wide range. Yikes. All right, I'm going to go ahead, guys. This has been a fabulous conversation. I love it, love it, love it. I'm going to go ahead and stop the recording. Damaris, Kevin, thank you so much for taking the time to answer all of these questions. It's absolutely been wonderful and a little overwhelming as well from a parent perspective, but we're so grateful that you've taken the time.